California is recognized.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here. And I just appreciate you pointing out the benefits of the ACA, everything from access to preventive health care, doing away with the pre-existing condition limitations. And remember, before we passed the ACA, being a woman was a pre-existing condition. Getting a handle on prescription drug costs, no more junk policies. There's countless examples of my district and everybody else's district of how people that we represent have benefited from this, and thank you for your ongoing support. I'd like to ask about two priorities of mine, mental health and telemedicine. I'm grateful that you and President Biden have made mental health a high priority, but I'm concerned that too much of our focus is on treating the symptoms of mental illness as opposed to understanding its underlying causes. There's not enough money in any president's budget to treat every mental health symptom. We need to get ahead of the curve, and that's why Mr. Kelly and I have legislation that will provide tax incentives for brain research. I've sent that bill to Treasury to get their comments, and I'd appreciate it if we could send it to you and get your team's comments on that as well.
Absolutely.
Thank you. And I'd also like to ask about telemedicine, and thank you, Mr. Smith, Nebraska Smith, for raising this issue. It's been a long-time priority of mine, and I think one of the few silver linings in the COVID cloud, as you know, that we passed my legislation to allow Medicare beneficiaries to access health care services via telehealth. And that was a real help to them, and it really provided a better means by which providers could treat their patients. And last year, we passed a 2-year extension of those telehealth flexibilities. Part of the reason we passed that extension was to give agencies, including HHS, the opportunity to study health utilization over the past several years, how it was used, where it can be approved, and how it's affected costs. I have legislation with Mr. Swigert, along with our colleagues on the Energy and Commerce Committee, which would make telehealth a permanent part of Medicare. That bill, by the way, was sponsored last year by over half of the U.S. Senate. So as the 2-year extension plays out, I'd like to know how you envision the role of telehealth in the future, particularly in Medicare programs. And is there anything specific that your agency is looking at to make sure that we have the best handle on this?
Congressman, I know we don't have much time, but what I'll tell you is that we've seen the dramatic results in behavioral health. We weren't sure what would happen with folks who needed mental health care services. We thought perhaps they needed to have that person-to-person contact with their physician and their healthcare provider. It turns out that one of the greatest gains was made in mental health, where because you could do this in the privacy of your home, you felt more comfortable coming forward and accessing mental health services. At the same time, we saw a dramatic drop in missed appointments because now you didn't have to worry about traveling there if you didn't have transportation. We hope that we can work with our states to figure out how we deal with the cross-state issues that are involved with licensing of medical practitioners.
And is it fair to say you're for making it permanent?
We are absolutely, it depends on where we're going, but yes, there's absolutely a need to continue some of these telehealth flexibilities.
Thank you. I yield back.
Recognize the gentleman from